The research that's actively ongoing, and it's not just the August 19th Canadian study published by a group at York, it's also recent research published from Mexico and some prior research before that. And it's very controversial. Anti-fluoride groups are saying, see, this is a poison that is affecting brains. This is the biggest shameful moment in the history of public health. So that's the narrative you have. Pro-fluoride advocacy perspectives are attacking the research and saying it's discredited, it's terrible research. So that's what's being said. And you're going to, I mean, again, I say this respectfully, I think we're going to hear that in this chamber today. In between those two viewpoints, I'm going to say there are credible peer-reviewed journals that are publishing this work. The most recent Canadian study was published in JAMA Pediatrics. Anyone knows that publishing in the JAMA network journals, the Journal of the American Medical Association, incredibly difficult. Work is scrutinized. And this particular work was actually double reviewed, and there was a supplementary statistical review for the August 19th Canadian study. There are accompanying editorials that have far from discredited the work, that have said that this requires attention and needs to be considered in context of other evidence that's emerging. The studies can't be undone, and they can't be unpublished. Huge amount of public resources, both of the big cognition studies were funded by the NIH, National Institutes of Health, which is incredibly competitive funding, tremendous amount of rigor in the review of the proposals to do the work, and then many years to do the work. And if there's one thing that I get angry about as a person who supports research, is the notion that you can just talk away the 10 years of work by committed investigators. That's the only thing I get angry about, because I respect the doers of the research and the deliverers of the evidence, and I don't think they should be shot for tough messages. There was a CADITH rapid review. So CADITH did the big review, and at Dr. Figueiredo's request, a CADITH rapid review was done of recent cognition studies related to fluoridated water supplies. CADITH reviewed the literature, and through that process identified one notable new study, and that is the York University study of several Canadian cities that found an association between high intake of fluoride or higher intake of fluoride in pregnancy and lower cognition in children some years later, a finding that for the best measure of fluoride intake, which is urinary fluoride, was only seen in boys, not girls. Other measures of fluoride intake were seen in both boys and girls in terms of cognitive effects. The CADITH review did the process of reviewing the study design, were confounders attended to, was the analysis correct, number of things. Were there selection biases? Was the sample size sufficient? And they identify a number of limitations that, again, I think you're going to hear about. And then they make a bottom line conclusion. The evidence, this is verbatim, the evidence is weak due to multiple limitations. But then they also say this cannot be ignored, and further well-conducted research is now needed to address uncertainty. So that's the CADITH comment on the cognition study from August 19th. On Tuesday last week, a US report in draft form was released by the National Toxicology Program. And this is a formal systematic review, very extensive, and it is informing a November 6th public hearing in Washington, D.C. So if any of you want to go on a trip and visit the Lincoln Memorial, November 6th. And this review looked at a far broader sweep, 149 human studies and 339 animal studies on fluoride intake and cognition. And the review, this is verbatim, concludes, there is a consistent pattern of findings that high fluoride exposure is associated with decreased intelligence, IQ, in children. And then they go on to say, NTP, so the National Toxicology Program, concludes that fluoride is presumed to be a cognitive neurodevelopmental hazard to humans. And the presumed category is a formal designation where potential toxins are alleged, possible, potential, and then it goes to presumed and definite. To be a definite neurotoxin, there would have to be a clinical trial demonstrating the neurotoxicity, and there can never be a clinical trial of this. So observational research like that conducted is what, that's the highest level that it will have given the evidence. And then they conclude, these are verbatim, this conclusion is based on a consistent pattern of findings in human studies. So for the suggestion that there's only one study, there's one study in a community water fluoridation context. There's many studies, and notably there's a Mexico City study where the levels of fluoride are similar to the Canadian fluoridated cities. They say, and this is important, when focusing on findings from studies with exposures in ranges typically found in the US relating to fluoridation, effects on cognitive neurodevelopment are inconsistent and therefore unclear. So I want to say that because we have to hear that, inconsistent and unclear. So an editorial comment from the Institute team, no one knows for sure. And no one should act sure, because if they act sure, they can't be sure. We're trying to be really objective and balanced, and we're just giving you verbatim statements. There have been calls very recently for access to the data from the recent York University study, and in a letter that was sent to the NIH last week, 20 or so Canadian, or no, actually North American academics wrote to the NIH denouncing the recent Canadian cognition study, critiquing it on many levels, making assertions that the team at York University has refused giving access to their data. And they're refusing to permit reanalysis, and they are not being transparent. These allegations are false. The authors, in fact, are in an active process of discussing with Health Canada a Teflon, bias-free process of making the data available for a secondary analysis. And again, I said there's one thing that really gets under my skin, and that's an assertion, attacking messengers.